Welcome to On the Level, broadcasting from the Blue Ocean Network studios here in Beijing. My name is Fergus Thompson. Now, any city that 20 million or so people call home has got to be a fascinating place to work and live in, and in this respect, Beijing is no exception. But is it a healthy city? Well, not if newspaper reports over the past 5 or 6 years are to be believed. These tend to concentrate on the negative effects of the environment of those who live in Beijing, the notorious Beijing Smogs, it's known. But for those of us who do live in the city, there are also other concerns. The food that is bought in restaurants, in markets, indeed the soil in which that food is grown. So is it possible to survive, never mind to thrive, in Beijing? Well, my guest today on The Level has been writing for quite some time about the fact that living in Beijing does not have to be that toxic an experience. And he argues that those of us who do live here have a lot more control over the conditions that affect our health than you might think. Dr. Richard Saint Cyr is a family medicine doctor from America. He's been here since 2006. Currently he works in the Beijing United Family Hospital, where he's also Director of Clinical Marketing and Communications. He is an avid columnist, writer, blogger, tweeter. He has a book out now, generally about China-related health matters, and more recently, he's got an even more compelling reason to worry about the air and other environmental aspects of Beijing, and that is a 1-year-old son called Alex. Richard Saint Cyr, welcome to On the Level.
Thank you, Fergus. It's good to be here.
Now, Beijing has become something of a whipping boy for the domestic and the international press, particularly for that reason that I mentioned, air pollution. Is it that bad?
Well, I suppose it depends on how you look at everything. There's just a lot of black humor these days about air pollution. One of the good things, I suppose, for us this year is that now India is the whipping boy now. So just a few months ago, just last week, Delhi is actually the worst city in the world for PM 2.5, for pollution. And I think 13 out of the 20 cities, the worst cities in the world, were in India. So there's been some interesting press related to that over the last few months. But it's actually kind of fascinating because Beijing and China has been sort of the whipping boy for pollution.
Bit of Schadenfreude from the Beijing, presumably, about these other countries.
Yeah, so it's nice that we're not number one anymore when it comes to pollution. And of course, India, the comparison is actually fascinating. India is actually really upset that they're actually in denial about how bad their pollution is. They're sort of like Beijing was a few years ago. We
should explain perhaps that every morning when people in Beijing wake up, and we may not be the worst in the world now, but it's still sometimes there are those grey days, and people look at their smartphones in general and check apps which show them exactly what the quality of the air is like today. So just perhaps to give viewers an idea of what we're actually dealing with here and how we deal with it, this is the sort of thing you might wake up to in the morning. This was taken earlier today. Maybe just talk us through what this app is. There are several of these apps, but they're mainly the same idea.
Sure. Well, just the fact that we're doing this is actually kind of fascinating, because almost everyone in China actually is doing this now. And it's just something you just can't even comprehend as an American or anything like that. We actually are checking these apps now for air pollution numbers, and we are following the numbers. It's just been an extraordinary thing. And, but
it's that number 180.
So the 180 is the AQI, Air Quality Index, there's rankings from different countries. Every country has a different system. So the more important thing is that this lower number, this PM 2.5 micrograms per, if you want to make pollution universal across countries, since the AQI is different, that the actual number is this bottom number, this 112, and literally it's just a calculator that goes from concentration to AQI. So concentration is difficult to grasp. It's easier for the public to understand, oh, AQI. If AQI is under 50, that's a good day. If it's over 50, it's not a good day. It's more polluted.
So how does 180 fix into that?
Oh, 180 certainly. Anything over 150 in most countries, U.S., China schedule, 150 would be unhealthy for most people. Certainly over 200, definitely would be considered, and certainly over 300 is more considered like a public health emergency.
And we've got these monitoring stations right around the city there, the 180, 145 and so on. That's the index, but that's the difference there, as you mentioned, different figure for 2.5.
Yeah, so it is confusing. I guess if you want to step back a little bit, the actual health effects, why are we doing this in the first place? If you go to just the concentration, the number, the goal was to be under 10, so a concentration under 10, PM 2.5, that's when their health effects are almost basically kind of approaching 0. Anything over 10 starts to be bad for your health. So it's totally relative what you're talking about. So, for example, the American Lung Association just last week published their State of the Air, their annual report. And the worst city in the entire country of America is, I think it's Fresno, something in Southern California.
Right.
So their PM 2.5 is 18. So that's the worst PM 2.5 in all of America.
Is that 80 or 18?
18.
18.
And the best is actually 5 or something, near the Grand Canyon.
Right. Well, this is the last 30 days in Beijing.
So if you want to talk about a PM 2.5 concentration of 12, that equals a AQI of 50. So.
Right.
So basically, this AQI of 50, this green zone, is what you're shooting for.
Right, which we didn't.
And yeah, as you do notice, not one day in Beijing last month had an average in the healthy day. Right. And in most cities in America, you wouldn't even have one day over 50. So there is a very, and this is typical for pretty much every city in China and India, the developing worlds. It's certainly not just China, but the perspective is very different here. So.
You mentioned the developing world, and countries change as they develop.
Yes.
What about the situation in countries like the United States or Europe back in the 70s? I mean, we grew up in cities which were not crystal clear.
Yeah, exactly. So that is an important point. Every industrialized country has gone through the same process. You pollute your air, your water, everything's a mess. Dickensian London, all those images. Every country goes through the same process of destroying their environment. Then you develop a middle class, and you develop a movement to clean up the air. It's the same thing. Mm-hmm. So China's doing the same thing. It's just they're doing the same 100-year process in like 20 years.
Well, we do hear about the possible effects in terms of affects cancer or heart disease, lung disease on people who are constantly exposed to these.
Sure.
But did that happen in the 1970s in Los Angeles, Tokyo in the 60s and 70s? Did swathes of the population expire because of pollution?
Probably. Of course, we don't have much good data on that. But of course, black lung from being in the coal mine, the chimney sweepers, they did die early. And it was because of carbon-based
But even
pollution.
in the more recent past, say, in the time when I grew up in Europe in the 70s,
yeah.
we had these pretty grey days. Were we also at risk to these diseases, and are they showing up in people in their
Sure,
60s
yeah.
and 70s?
The problem is it's hard to compare the data, but because the monitoring systems, we weren't really monitoring PM 2.5 back then because we couldn't. We didn't have the right technology.
Right.
It was just thick stuff, black soot or something.
It's a little bit insidious. How do we get people to be more aware of it, or do you think that people in Beijing are already very clearly aware of the problem?
I don't think you can be more aware of pollution now than ever. Compared to a couple years ago, there was more of a denial, but now that there's all of this,
Yes.
there's the numbers, it's not just the U.S. Embassy anymore, there's 30 stations all over Beijing,
right,
and 1,000 all over China doing hourly monitoring now.
Just to explain on that we did have, up till a few years ago, official press talking euphemistically about the fog or the haze, the yellow fog that had hit Beijing. Yeah. And the US Embassy was involved in tweeting these AQI figures at a time when it was neither profitable nor popular amongst the officialdom here.
Yes.
But it did seem to have a knock-on effect, and after that the officials in Beijing did start to, as we saw on that map there, produce figures from all of these sites over up PM 2.5. That's it. These are more dangerous, aren't they? These smaller particles.
So before everyone was following PM 10, and the PM 2.5 is basically 2.5 microns, and it is literally small enough that you can just.
Why is that more dangerous than these larger particles?
It's because the bigger stuff just gets stuck in your upper lungs, in your mucus, and the smaller stuff is almost like a gas. It just you just breathe it deep into your lungs, and it goes right into your bloodstream. So. It just floats around your bloodstream, and it causes free radical damage. It causes heart disease, lung disease. Not just lung disease; it causes heart attacks. So the elderly people that are frail and the people that have had heart attacks, they can get a heart attack from air pollution. It's an inflammatory disease.
This is the problem as it stands at the moment. But you, as I mentioned earlier, you are on the side of proactiveness, of prevention, and doing something about this. So, just on this area of air pollution, what can somebody who lives in Beijing do about it at the most basic level if we go out in the streets on one of those plus 300, 400 days?
I think just be educated about it first. And I try to point out to people that the relative risk of air pollution still isn't as great as many other things in our lives. I think there is an over dependence on this issue because it's everywhere, right? You can't avoid it. But there are many other things that are still more important to our health, including Gosh, the global burden of disease, this World Health Organization list. So nutrition is the most important factor in Chinese health than air pollution by far. It's much greater. So,
but it doesn't get. It's not a sexy.
It's not a sexy topic, but
right.
Salts, overuse of salt in the diet kills more people than air pollution in China. The good news is that yes, it's a serious thing, but the relative risk compared to many other things, it's not as high as you think. So, if you do take basic precautions, you can have a perfectly normal, long life here. There, at the very least, an air purifier in your house. Like 90% of your life is indoors. So. And 1/3 of your life is sleeping, right? So at the very least, just get a good air purifier in your bedroom. And certainly for your children, at the very least, take care of your children.
So these are machines which will actually clean the air within your room or a number of rooms if you have several of them and,
yes.
and produce air that is not going to be damaging for you.
It decreases the exposure, sure.
Right.
So it depends on how effective it is.
Right, so that's a building, it could be your employer, it could be your house.
Sure.
Personal, yourself, when you're out in the street. Now, I believe you use a bike or a motorbike. I cycle here. We've all got used to using these masks, which we wear everywhere. This sort of a thing here. I mean, this is one type. I believe there are others. We wear. You see these everywhere in the streets these days, which you didn't 4 or 5 years ago. Are they effective?
I don't see them actually as much as I would like to.
Right.
We see them more than we used to. Sure.
Yeah.
So that issue of the masks, that's the other big thing expats are always talking about. So what kind of air purifier do I need? What kind of masks do I need? Unfortunately, the data isn't very clear. There isn't an official recommendation from World Health Organization. There isn't even good data as to if it's effective or not for long-term use. It just doesn't exist yet. So I've done my own testing. I've done a lot of I've read all the research, and I'm very frustrated actually that there isn't a consensus. There's no medical consensus. I would love to get something from the WHO or even like the US CDC or China CDC recommending you should wear a mask when this AQI reaches this certain number. There just isn't data on that. But no matter what, we know that if you decrease your exposure, that's a good idea. So I personally think it's very reasonable to wear a good mask outside. So my cutoff is 200 or something. When I bike to work, it's an electric bike, so there's like no exercise. But that's another story. We won't go there.
Well, let's go there.
But I do wear a mask. I should exercise. I'm over 40. I need to exercise. But
is it better not to exercise when the air is bad, or should people in Beijing be running in the streets? We have marathons here.
Well, this is one of the good news. It's one of the things I'm trying to empower people about. There's actually pretty good data, even in China, that exercise outside still is much better, for example, than no exercise.
Right. So that's not an excuse.
It's not an excuse. They've done biking studies in the Netherlands. They've actually brought together data from London, and the numbers weren't so much lower than China, for example. So there is good data. But basically, the cardiovascular benefits of exercise are still like 9 times higher than the risks from air pollution and traffic and things like that. So it's not even close. Right. So that's what I'm talking when we talk about these relative risks. So it's pretty clear that exercise on almost any day still is much better than no exercise. So biking is great. And they did a study even in Shanghai of women outside. And the women in Shanghai, the more they did outside, actually they were better. They were healthier.
A survey came out, Ministry of Environment released finally these figures after a year, saying that 19%, fifth of the soil in China polluted. Now, we're not talking about very innocuous stuff, cadmium and nickel. This was considered a state secret until a year ago, but it seems screaming and kicking, this has been dragged out. What can somebody, an individual, do like that, somebody who's living in Beijing? How do they know where the food that they're buying has been produced?
That's a tough issue. I mean, I think controlling, so again, here's another example. How can I control my food choices here? And obviously, it's a little bit disturbing. Only poorer people can't really afford organic food, but they can afford organic food in any country, right? So that's just not just a China thing. But so, of course, it'd be better to have safer food, sure. So, and it is good to avoid pesticides and chemicals as much as you can. So it is an issue. Food safety and air pollution are big issues in China. It is a tough issue. I personally, like to get. I've found an organic farm that I deliver food from a couple times a week. And I make my own organic yogurt, for example, every day. So I take control. And actually, I I buy imported organic milk, things like that, which you can get everywhere in China.
So, but again, we're talking about that level of trust, trust in the water purifiers, trust in the organic farm.
Trust is difficult in China. I mean, people in China, everybody, not just expats, but local people, it's a serious problem, trusting your food choices. So it is a big problem.
You work with a mixture of people from overseas, expats here, and Chinese patients. Do you find any differences in the attitudes towards these safety matters that particularly arise in Beijing?
No, and the polls show it too. So air pollution, food safety, those are actually number 1, number 2 for everybody. So you just can't avoid it. So this, as the middle class grows in China, these consumer issues are pretty much the same. I think it's great because it's forcing the issue, and it's forcing companies to be better, and it's forcing better food choices. So this conversation is much more robust than I've seen it. I've been here for 7 years. So the swing towards awareness is great. So we're still waiting to see, I mean, it's going to take years for the air actually to get better, but the conversation certainly has started now. So it's that's the first empowering choice. The first empowering choice is getting the information that you can trust, and then you decide what to do with the information, and then you make your own choices after that.
But once you know what to do, it can cost you money. You mentioned briefly there the organics, but also the air purifiers, if you get a water filter, even masks for some people are going to be quite an expense.
Yes.
Is it health for the rich in Beijing and bad luck for the rest? Because we're talking about so many people who are migrant workers here, people who come into the city and live, very, very modestly. What can they do? Is there anything that they can do?
Of course, this isn't a unique problem here. Certainly in America, if you're poor and you're on food stamps or something, you don't have the best food choices. You can't buy the organics in general with the food choices there, or the baby choices, things like that.
You can be more sure that what you are buying is not going to be
in terms of
poison.
The trust of the product, sure. But in terms of the nutrition status of poverty versus, so there is maybe a little bit disturbing issue of access, sure. So obviously it'd be better if the air was cleaner for everybody, of course, because that affects everybody. So, and food choices affect everybody too. I think everyone just has to choose what they can do. They have to take control over something, and we just have to kind of, I guess, trusting something in one step at a time.
What are the other health effects that may affect people living in China, apart from the air and the water and the food? You mentioned nutrition there.
Well, like I'm saying before, this global, so the air pollution is only number 4 on the list of lifestyle. And I guess you consider air pollution a lifestyle decision. So, because you sort of have a choice in where you live. But nutrition by far was number 1. So heart disease was the number 1. So food choices is the most important. So actually, lack of exercise is a more important discussion than this. The diabetes epidemic in China is more important to discuss.
Diabetes
smoking
is on the rise here.
Oh, diabetes it's already the most prevalent incidence of diabetes in the world.
And this is not to do with pollution or anything. This is to do with a change in lifestyles.
Sure, the change in lifestyles, yes. So, and you still don't see a lot of super overweight people in China like you would in America, for example. But already they have a lot of diabetes. So that's very scary. So, and of course smoking. More than 50% of men in China smoke. But these lifestyle things and being overweight is much, much clearer data in terms of shortening your lifespan than air pollution. So that's a key point that many people just get lost in. And I just try to hammer that away. I don't want to be just the air pollution doctor. I want people to feel like they're healthy. I don't want to be a downer all the time. I want people to walk out of my office or after read my blog saying, okay, I can do this. This is manageable.
Right.
So if I'm spending $20,000 on an air purifier, but I'm not exercising and I'm a light smoker, you are totally worrying about the wrong thing. So many people, they're just lost focus. Like anybody is worrying about the air pollution. I've done the research too. An average day in Beijing is only equivalent to 1/6 of one cigarette.
You hear these sort of wild rumors on Weibo, that's the Twitter here, about a day in Beijing is like smoking a packet of cigarettes or something.
No, it's pure nonsense.
Right.
So no country, no city in the world is equivalent to 1 cigarette a day ever. So is that debate, that mindset. So anybody, so should China spend more on getting everybody to quit smoking, or should they spend money on cleaning the air? It's actually very debatable. What is the best bang for your buck for public health money?
Right. You write columns, you write a blog, you tweet, you write on the Chinese Twitter, which is Weibo here. You've published a book now, or you are about to publish a book. What's it called and what's it about?
It's in Chinese, so it's basically a translation of like 100 of the greatest hits, I suppose, from my blog. So, and my Chinese isn't that great, so I could never have done it without them. But it's called An American Doctor's Journey to Good Health in China.
Okay.
So it's really long, but there's a big picture of me in the front page, and talks about me, and I married a Chinese woman, and I have a mixed child now. So basically, the point of the book is what I've done for expats, just sharing how to live healthy in China.
It's in Chinese, you said. So it's aimed at
yes. So it'll be
Chinese
published
citizens.
in about 2 weeks all over China through the bookstores and through online.
Might you bring out an English language version?
Sure.
You wrote it in English, so it shouldn't be that difficult.
Yeah. So I mean, you can read it all on the blog already, but sure, they might package it. But I think for me, it's thrilling to reach all of China. Instead of just the niche of expats. So if I can have a health impact and just get a few thousand people here and there to live healthy, as a family doctor and a community health doctor, for me, it's wonderful to have that kind of any impact.
You recently gave a TEDx talk about this particular topic. That was to students here in Beijing, was it?
Yes, UIBE, University of International Business and Economics.
What were they interested
UIBE. So they came to me last year and asked if I wanted to talk and if I had an interesting topic. And of course, TEDx is kind of ideas that matter. That's their quote. So I was trying to brainstorm, and it was a great honor to do a TEDx talk. So I really wanted to have a powerful message. And I think actually in China, it is a powerful message that you can live healthy. It seems obvious in many places, but this mindset, as we're continuing to talk about it, initially, people don't think that way. And just the psychological aspect of being negative, health involves so many things. But the psychological aspect of happiness, just thinking about pollution or being stressed about pollution probably causes you more health damage than the actual pollution. So stress and your health, there's a lot of data on that, much more than there is pollution and health, so much stronger. So your attitude and your positive attitude actually does take a big part. So I do mean it when I say you do have to feel empowered, and you can feel empowered, but you do have control over what you're doing. It's not just what you're buying. If you can't afford a 10,000 RMB air purifier, you can get a 200 Kwai one, just a filter on a fan, and that is actually not bad either.
Those are positive choices that people can make, but there's also the chance in a city like Beijing or a society like China of not taking the negative choice. I'm talking about, as you mentioned, smoking is much more prevalent here. Alcohol is much more prevalent and cheaper. It's also ingrained into much of the business and social society. Are these things that people coming to China find as a problem or that affects them?
Yeah, I actually coined kind of a phrase a few years ago from a sort of pattern of expats. I call it expatitis. There's a certain percentage of people when they come here, they actually sort of fall apart, or they just live large and drinking and smoking more, and they just kind of fall apart. And there's a certain percentage that are better too, but it's sort of like that Wild West mentality. It's changed a little bit now. It's a little bit more professional, but there is a certain percentage of people that sort of fall apart here. They do have to watch themselves
far more serious effects, presumably, than the atmosphere.
Sure. So no matter what, this idea of chronic diseases, non-communicable diseases, what the WHO calls it, but the whole world is dying of chronic diseases now. And the chronic diseases are heart disease and strokes and diabetes-related complications and obesity things. And it's all lifestyle. Like 80% of this is lifestyle-related. It's not exercising. It's red meat instead of other things. And it is this change from a previous lifestyle to a modern lifestyle. And China is still a developing country, but they're already dying of these chronic diseases. So the conversation should still be about that.
Having seen other countries go through this, and we've seen Europe, the United States go through this decades ago, is it not incumbent on the Ministry of Health here to say, look, we've seen this happen before, we can stop it, we can do something to stop it happening here? Is there not more that can be done in that preventative way? Yes.
There's so many things in China that are kind of overwhelming problems. I mean, so what do they focus on with limited healthcare resources? So I think they're doing astonishing changes with air pollution compared to, let's say, India, which is still in denial. So, I mean, and I think if anybody could clean up the air in 5 to 10 years, it would be a country like China, which would just kind of enforce things. But again, there's also the issue with hospitals. People can't get, there's no primary care system in China. So as a family doctor, everyone goes to specialists, things like that. No one's being diagnosed with their diabetes until it's many people. But this idea of preventive medicine, that is probably much more important for China, to train 100,000 family doctors quickly and get them on board into these clinics and to diagnose diabetes and high blood pressure before it's too late. That's probably much more effective use of money.
That's what you would do.
Well, as a family doctor, and I take care of chronic diseases, and it's too late, obviously, if you have the diabetes. You have to diagnose them earlier, and you have to educate people about why they're developing diabetes. It's because they're overweight, and it's because of the food choices. So this idea of prevention is crucial to what a family doctor does. And personally, I think that would be more important long term if you really want to radically change the health of people in China. And probably the other thing would be a massive anti-smoking campaign, and you markedly raise the taxes on cigarettes. That would instantly cut down on the prevalence of smoking in China.
Right, but there are problems there in that so much money is made from those taxes on smoking.
Yes,
but of course it's going out on the healthcare problem.
Sure, but if you want to talk about a dramatic and quick thing, raising taxes on cigarettes, that type of thing, is really easy to do.
Your book, as you mentioned, is a sort of a compilation of much of what you have written online. You have a very wide presence online. You're known, as I said, in treating, being a sort of a social network doctor. Does that ever impinge on your personal life? Do you get people sort of saying, "Look, I've got this wrong with me. Can you give me a diagnosis online? I don't want to come into the hospital and pay money."
Sure, I get little private messages from people saying, "Oh, my child has this, or I have this. What can you do?" And in general, you can't really answer that. You just never give. As a profession and as a HIPAA violation, you just can't really give health advice. But it's not that common. But that's what every social media doctor has to deal with online. So there is a certain trick. And in terms of my blog, I control the comments, of course. So nothing can be posted if I don't moderate. It has to be a certain professional level. So there's always the risk of that. But in general, I've had major negative problems. And the New York Times column for me has been great. And I get feedback from that, but no patients coming to see me from that. But in general, of course, it's been a major plus for me. And we encourage, as the director of marketing for my company, we definitely encourage our doctors to explore social media. And it's the same concept, like don't say anything online you wouldn't say in an elevator in public or something. If you think you're going to talk about a patient in an elevator and it just sounds like you shouldn't be doing that, you shouldn't be doing that online. You've
been here since 2006.
Yes.
That's quite some time. Will you be here in another 9 or 10 years' time? And if so, do you think you'll still be writing about health problems in Beijing, or will some of those have been overcome at that stage?
Well, I have a new boy. I have a 15-month-old son, and hope to have at least a couple more children. So I definitely want to raise my children here for at least the first 5 years, so they can get Chinese immersion, and they're mixed children, so Chinese, and I want them to experience their culture before, or if ever we went back to America. It's not automatic that we would. So, but I think I'm committed to at least 5 more years. Yes. So then I'm already a 10-year expat. So I never thought I would be here that long, quite honestly, but. I've sort of found a certain niche, and I personally really like my life here, and I personally feel very healthy overall in terms of what I'm doing and my positive attitude and my choices. So I feel like I'm healthy, even despite the things we always talk about. And I think my children can feel the same way too. When we talk about the psychology of health, just being in the capital of the most interesting country in the world right now of the next century. So that adventure and excitement, that also is a big thing. So I'll be here for a while, yeah. Who knows, 10 years, maybe. And I would love to do more impact in the Chinese community. So this book and the New York Times Chinese column, so it's the Chinese version, to have an impact on the Chinese side, that to me is very exciting. And as well, long term, if I could help bring primary care to China, and my hospital is doing that, we're helping be pilot projects and having a training program. So that to me is a very exciting reason for me to stay in China for a few more years, yeah.
Dr. Richard Saint Cyr, thank you very much for coming on the level, and good luck many more years of making people aware of health in China.
Thank you.